Hello viewers, welcome back to our Critics Tech channel. Just few days back on 28th of July, it was widely reported in the media that US multinational Pfizer expects $33.5 billion in revenue from the COVID vaccine by this year. Pfizer's annual revenue in 2020 was $35.6 billion. With the addition of just one brand, COVID vaccine, Pfizer expects to double its yearly revenue or possibly a lot more than that. In today's episode, let's examine whether COVID-19 vaccines are poised to become one of the world's most lucrative drugs. During the first week of February this year, Pfizer's full year vaccine sales expectation was just around $15 billion. 3 months later, in the month of May, the drug giant amended its vaccine revenue expectations and raised it to $26 billion, which was a 73% increase. And now, the company's projections have risen to $33.5 billion, a figure that is 123% greater than the first estimates at the start of the year. However, it's possible that even this adjusted forecast will prove to be an underestimate, since Pfizer now expects to secure further profit by selling booster dose of its vaccines. Viewers, please try to understand the trajectory. On 2nd February, only 2 out of every 1,000 individuals globally were fully vaccinated, and Pfizer's forecast for vaccine income at that time was $15 billion. 3 months later, on 4th May, the number of fully vaccinated people increased to 37 per 1,000 population, and Pfizer raised its sales forecast by 73%. On 28th July, the number of fully vaccinated persons hit 142 out of every 1,000 people worldwide, and Pfizer quickly raised the bar by 123%. Not only Pfizer, the narrative is the same for all pharma majors involved in manufacturing and marketing of COVID vaccine. Surprisingly, none of the vaccines brands now used for COVID-19 have received FDA approval. They are only permitted for use in an emergency, and they are currently under trial. As a result, all vaccines are at present candidate vaccines. There is no evidence of their efficacy or safety. Despite their dubious merits, the vaccines are primed to be big business for the drug cartels. The combined sales of all accessible brands of COVID vaccines may exceed the turnover of many companies, pharmaceutical companies. It is anticipated that the COVID vaccine sales will cross $100 billion mark this year, $100 billion. A recent study on the vaccines of Pfizer BioNTech and Oxford AstraZeneca, published in The Lancet on the vaccine efficacy of the first dose against SARS-CoV-2 infection. The study found that overall antibody levels begin to decline in 6 weeks following single dose immunization. In 2 to 3 months, antibody levels may also be reduced by more than 50%. So, even after being completely vaccinated, there is still doubt over whether the immunizations can provide long-term protections against COVID-19. Now, virologists believe that the Delta variant of the coronavirus can infect persons who have been fully vaccinated. On July 30th, ABC News reported on the current coronavirus infection outbreak in portions of the United States of America and said that 74% of the people who got COVID-19 attack were completely vaccinated. Rochelle Walensky, head of the Centers for Disease Control and Prevention in the United States, said that the recent outbreak in the United States caused by the Delta variation reveals that the amount of virus in fully vaccinated persons is quite similar to the amount of virus in unvaccinated people. So there is hardly any difference between vaccinated and unvaccinated person or persons. Therefore, the fundamental question is, what difference can today's vaccines make against COVID-19? In a prior episode, this channel already uncovered the doubtful efficacy of the COVID vaccinations that are now available on the market. Those who have not seen the video are free to watch. There is a link in the description box. Let's get back to the discussion. Moderna, a biotech company based in Massachusetts. Moderna has had its fortune totally transformed by the COVID vaccines. 1 year back, in the first quarter of 2020, Moderna reported a net loss of $124 million. 1 year later, in the first quarter of 2021, the company reported a net income of $1.2 billion. This has been possible because of a revenue rise related to commercial sales of its COVID vaccine. Moderna Incorporated earned its first ever quarterly profit due to commercial sales of its COVID vaccine. The Anglo-Swedish pharmaceutical company AstraZeneca repeatedly stated that the company will not earn profits out of its COVID vaccine during the pandemic. But the company has been selling the vaccine to governments for several dollars for a dose, which is otherwise less than the cost of the other leading vaccines. Despite no emergency approval for its vaccine to be used in the United States, AstraZeneca's COVID-19 vaccine sales more than tripled to $894 million in the second quarter of this year compared to the first 3 months of the year. Back home, Serum Institute of India, the world's largest vaccine maker and the collaborator of AstraZeneca. Serum Institute of India expects its COVID vaccine deals to generate $4 billion in income by 2022. However, the COVID vaccine partnerships might generate at least $1 billion in revenue for Serum Institute by the end of 2021. Not just the vaccine Covishield, but the new COVID immunization strategy launched by the central government in India has allowed the Serum Institute of India to dominate vaccine pricing to reap huge profits. The latest pricing announcement makes it obvious that the company is now aiming to generate a higher profit on the vaccine, which was originally developed by AstraZeneca Oxford University with 97% public funding. In today's episode, we have looked at how the COVID-19 vaccine is said to be one of the world's most profitable pharmaceutical products, and a small group of drug cartels is earning handsomely. I hope you had a good time watching this video. If you liked this video, please press the like button and share it with others. Also, if you haven't already subscribed to my channel, please do so right now. See you in the next episode of our Critics Take. Thank you.